we have members all over. We have in Mandera, we have in Garissa, we have in Mombasa, all over the country. We have our members where we reach out to them, and we have made them ambassadors in wherever they are. Yes.
And what kind of support can they get once they become a member?
Okay, once they become a member, they need to register with 2,500, a one-off fee. Once they are members, they get subsidized price treatment, especially the initial tests. They get subsidized prices. And then in terms of consultation to see the doctors, once you have Fertility-Kenya membership, we have negotiated for you. You don't pay for any consultation. And if you have to pay, it is subsidized. For example, if it's 3,500, you just pay 1,500. And for the tests, we have like a package that we've been given by hospitals where we work with. We work with hospitals where they do the tests, and for the treatment in terms of either laparoscopy or IVF, you save 50 to 100,000.
Okay.
Yes.
Wow, amazing. So giving them that kind of support when it comes to subsidized prices. And Dr. when it comes to what more can be done on the health front in terms of tackling this issue? You've mentioned some of the treatments, yes. IVF, but even in terms of specialists, where are we in terms of that in Kenya?
A very interesting question, and thank you for asking that question. I think, number one, we need to have a serious discussion ourselves. Kenyans, we need to have a discussion with the government. We need to have a discussion with the bodies that actually deal with the health sector. I'll start with the first one. We need to think how to help these people. The majority of patients I see in Kenyatta with infertility, and some of my colleagues as well, they're actually from the bottom of the pyramid, as it were. So when a young lady comes to me and says, you know what, I'm 27 or 25, I've been trying to have a baby for a year, 2 years, the man's side, everything is okay. We do a test and we find the tubes are blocked. There is no way we can do anything else other than to suggest that she goes for IVF. Now, when we suggest, we say, you know what, the cost is about 400K, it's astronomical. Yeah. They cannot afford this kind of money. So the discussion which we need to have is it possible, for example, for NHIF to actually subsidize the cost of this treatment? Even if NHIF said, you know what, out of that 400K, and the big chunk of that amount of money goes to the medications, which are very expensive. If it says we are going to subsidize it by even 50%, it will open up space for most of these patients actually to have treatment and to have that enjoyment of having a baby, or having babies for that matter, and so on. Right. Number two, when it comes to personnel, human resources, we don't have a lot, by the way. We can say we are lucky we have a few, because some other countries don't have anybody at all. But then looking at it against the background of the numbers that we have, then it's actually a tiny, tiny drop, you know, in the ocean. Right. Presently, if we talk about scientists who work in the lab, who actually do the mixing, let me put it that way, of the egg and the sperm, we call them embryologists. We have very few embryologists. So we rely most of the time on personnel from other countries. Right. So we need to have this conversation with institutions of higher learning where we can introduce these courses. And I think nobody knows about these courses, and that there's going to be a need, and there is a need, right. a huge demand. Okay. Going a little bit further about the specialists, there are also not very many. So we also need to talk now with the universities which offer postgraduate training, that some of the graduates, if they want, then we need to formulate fellowship programs, training programs, such that we can try and churn out more of our own specialists, right. instead of relying on people from outside.
Cecilia, I'll give the final word to you. Word of encouragement to a woman out there watching, probably in the same situation you were in a few years back. What would you tell them?
I'll tell them there's hope. There's hope. The biggest problem is to sit down and just think there isn't anything. If I stayed, I always say, if I stayed there, today I will not be having my 3 beautiful children. But I decided to come out and go get a solution. And I always say the difference between you and your baby is the money and God, of course. So you need to work hard, get that money, come for treatment. Yes.
Thank you so much, Cecilia, Dr. Kireki, for your time. We cannot exhaust this topic enough. In fact, during the break, we said this can take 2 days or 2 weeks.
Easily.
It's such an emotive topic, but of course, we need to keep talking about it on our kitchen tables, in our churches, in our mosques, in our salons, in barbershops, so people don't feel ashamed about going through this condition. And of course, it is not final. There are solutions out there. Thank you so much for watching. I'm Victoria Rubadiri. Thank you for the team. I'll see you again tomorrow evening. Jeff Koinange and I will be on Sunday Live. Have a lovely evening.